Hello, everybody. It's Dr. Cari here, and I am so excited to be here again for another one of our Wise Woman calls. Today, we're going to talk about hormone replacement therapy. And somebody sent me an email saying, "You're not anti-hormones, are you?" And I said, no, this is not what this is about. This isn't pro, this isn't against. This is to keep you guys informed. That's what's important. So I'm going to adjust my view for a minute, because I have it in widescreen and I have some notes I want to look at. So there we go. Okay, so hormone replacement therapy. What's really important to understand is that it's not necessarily needed for everybody. Some women definitely will benefit from a little bit of hormone replacement therapy, and other women, it's really not needed. The majority of people that I see in my practice do not need hormone replacement therapy. And as you'll see as we go along, there's a reason why it's actually better if we don't need it. But if we do need it, it's better that we use it. Yeah. So, there are over 1.4 million women that are currently taking hormone replacement therapy. It's 40% of all menopausal women are on hormone replacement therapy. That's a lot. And for me, that's a little bit sad because, like I said, not everybody needs hormone replacement therapy, and hormone replacement therapy comes at a cost. So the first thing I want to say is I don't think anybody should take synthetic hormone replacement therapy. Progestin. I was just reminding myself of the side effects of progestin, and the list is huge. But things like, so these are the more common side effects, things like excessive worrying, vaginal discharge, problems urinating, muscle, joint pain, bone pain, fluid retention, weight gain, changes in appetite. Those are the common ones. But then we've got breast lumps and inverted nipples and crusting, scaling nipples and migraine headaches, severe dizziness, it goes on, breathlessness, pounding of the heartbeat, sharp chest pain, coughing up blood, hello, seizures, depression. I mean, it's crazy. Please don't ever take progestin. It's not necessary. There are bioidentical progesterones that you can take if you need progesterone. Okay, so also, you know, they did that very famous NIH study, which they stopped partway through because they found that the synthetic hormone replacement was upping women's chances of heart disease and stroke and things of that nature, blood clots. So when we talk hormone replacement, we're only talking bioidentical. End of story. There's no reason to take the synthetics. Why would you take something that's sort of like something when you can take the bioidentical to what is as close as they can get to what is happening in your body? If you take estrogen and you change it slightly, it becomes testosterone. So how can you take estrogen and change it slightly so that it's patentable, which is what synthetics are, patentable medications, and then expect it not to have a big change? And this is why I think you see so many, scary side effects with these things. So when we're talking hormone replacement, we're talking bioidentical hormone replacement. Okay, I just want to make sure everyone's clear on that. Now, bioidentical hormone replacement has some side effects too. The first thing to know about bioidentical hormone replacement is there's never been a major study done on it. There's been small studies, but no major studies. The research that has been done shows that it's relatively safe, but there's never been a major study done on it. So that's just something for people to know. There can be side effects with bioidentical. So weight gain. I will say if you're on estrogen, you're going to be carrying at least probably an extra 5 pounds that you're not going to be able to get rid of by diet or anything else. That's going to be the estrogen. Estrogen has a plumping effect. That's why women who have lots of estrogen have lots of curves, right? It plumps. You can have tiredness, and very often though, I find that bioidentical, if you're on the right dosage, helps balance out energy. Acne, if you're taking testosterone, you got too much of it, right? You'll get acne. Same with facial hair growth, just too much testosterone. Headaches, anytime you're on hormones and you have headaches, you start wondering whether or not you're on too much of it. breast tenderness, a sure sign that you've got some estrogen dominance going on. Either your liver's not clearing what you're taking too much, you don't have a good ratio of estrogen to progesterone in your body, something like that. Spotting, cramping, again, those are all things that show that you're out of balance in the hormones. And so you want to really, so what's really important when someone's considering hormone replacement therapy is 1A, to determine whether or not you need it. We're going to talk about that. And B, to make sure that you're on the right dose. And there's a C, and this is super important, that you're conjugating it in a way that is safe. So when estrogen is metabolized in the body, it goes through, it gets broken down into 3 different kinds of estrogen. And you want a balance of those, but primarily you want one kind of estrogen that's sort of protective. And then there's another kind of broken down estrogen that is, they call it proliferative. So it's really great for bone density, but it's proliferative towards the breasts and the ovaries and things like that. So can be a little bit cancer promoting. And then there's a third kind that is downright not good. And so when we take bioidentical hormones in, if we're conjugating them and breaking them down into the bad guy, that's not good. So you can't just go get a blood test and start taking, I mean, you can, but I don't recommend going and getting a blood test and starting to take bioidentical hormones, okay? Not recommended. What you want to do is, yes, you can do a blood test. Your doctor might run that shows that things are off, but then you really want to do something called a Dutch test. Dutch test looks at urine, and it looks at how you conjugate out the hormones and which pathway they go into, which is super, super important, right? For the reasons I just said. So you don't want to just lightly go start taking hormones. If you are on hormones, you do not want to suddenly stop taking them. Oh, I forgot. Oh, I ran out. Oh my God, that is the most unkind thing you can do to your body. Know that when you're taking bioidentical hormones, your own production goes down. So if you stop it, you send yourself into a drastic low hormone cycle that can really be uncomfortable, and people don't understand what's happening. I will be honest, I have done that to myself twice. Not that I stopped taking them cold turkey, but I weaned myself off too fast. I thought, oh, I don't want to take these anymore. I'm feeling good. And I completely crashed myself. For me, it really crashes into the energy and then moods, super like, you know, freaky, funky moods. I do take a little bit of bioidentical hormones. I will tell you my story, and I will tell you why as we go along. Before I went into perimenopause, I was anti-hormone replacement. That's how I was trained. Don't need it, shouldn't do it, bad for you, no, 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 until I got thrown into a very, very severe perimenopausal syndrome that involved things like phobias. Can't get into an elevator, can't get into the backseat of a car, couldn't drive into a parking garage, couldn't get on an airplane, things like that, that came after one of my practitioners recommended that I go at age 47, tricky time, ladies, that I go to one of those drastic detox centers, and where you're using wheatgrass in every orifice. I call them enema camps, enemas and drinking raw food and sweating and exercising and all of that. He thought that that would be good to clean out my system. But what it did instead was put stress out my system. And stress is the major reason why we're not able to make the hormones once we transition from perimenopause into menopause. So let's back up and let me tell you about that. So let's just take a deep breath. I know I jumped right in and I didn't actually ground us or center us or anything. Okay. So when you are in for your fertility years, your hormones are produced by your ovaries. When you go into the menopausal years, your hormones are produced in your fat. One of the reasons we put on weight. And by converting a hormone that is made by your adrenals into estrone, a new and different, fabulous form of estrogen. So during this transition, you are transitioning from one type of woman into another type of woman. I talk about this a lot. but it's super important. Remember, if you've heard me speak before, you may have heard the story where I went to a lecture by a doctor who was saying that women are basically biologically done post-menopause. Hello. Are you crazy? Nothing could be further from the truth. It's not some like curse that we carry. I swear, I think that's back from like the dark ages when they used to think women were the cause of everything. It's not some curse that we carry. It's actually a divine design. We are shifting our roles in our tribe, in our community. And as that role shifts, we don't need the same hormones. Estradiol gives us superpowers of like multitasking and paying attention to lots of different things and making sure everyone's safe and focusing on other people and taking care of other people first. You know what I'm talking about. Now, estrone makes us, I love that estradiol is a 2, and estrone is a 1. And estrone gives us the superpower of turning within, of thinking about ourselves, of distilling the wisdom that we've attained throughout our life so that we can go back out in the world as the wise woman, which is our new role, right? But when we're in the period between the one phase and the other, it can get bumpy. It isn't for everybody. Some people, it's super easy. My mom went through it. She didn't even notice anything. That wasn't my experience, as I told you. So it isn't that it has to be bumpy, but it is often. In the United States, we have a high percentage of women who experience perimenopausal syndrome, about 70%. That's a lot, right? And so we've got 70% of the women, and nobody's talking about this, and your doctor is not offering you hormone replacement, thank God, or they're offering you the pill. I remember when I was 40 and I went to my doctor and they said, I said, I get curious what it's like for you guys when you go to doctors, because I don't really rely on doctors a whole lot. So I went and I gave her a list of all my symptoms. And you have to remember that I was at 40, I was still pretty heavily in the whole Lyme's disease, SIBO, mold sickness thing, right? So I had a list of symptoms. I gave them to her and she looks at me and she goes, "Oh, well, how old are you?" And this was a very smart doctor. And I said, "Well, I'm 40. And she said, "Oh, well, perimenopause, as she went down the symptoms, perimenopause. Oh, and this one you need to see a chiropractor." Well, hello, people. And then she said, "If you like, I can put you on the pill." No, by 45, I didn't have any of those symptoms, right? None. It isn't just perimenopause. It's a body that's out of balance. And perimenopause aggravates a body that's out of balance. So somebody wrote me a question and said, "How do I know if it's perimenopause or something else?" She goes, "I keep having these symptoms thinking it's perimenopause, but I find out it's that I had a gas leak or that I got exposed to mold or something like that. How do I know? I'm so confused." And I said, it never is, and it always is. Once you're in your 40s, your hormone fluctuations are playing a role in the experience you're having, no matter what. Now, but what's causing the hormone fluctuations and the craziness is the other things. Does that make sense? So you always have to look for what's stressing the body out. It might be lifestyle choices. It might be food choices. It might be heavy metal toxicity that you're getting from amalgams or vaccines or something like that. Not the COVID vaccine. They didn't put heavy metals in that. It could be chemical toxicity. I saw a lot of that during COVID, right? Because everyone was cleaning like crazy, and all the hand sanitizers and the airplanes are cleaned and the hotels are cleaned, and everywhere you go, you're getting all this chemical exposure. I stayed at this one hotel and they literally came in our room and washed the floor with bleach. I was like, "Oh yeah, no more room service." I mean, no more room cleaning, you know? Anyway, so stress is what throws the body off. When the body is under stress, it no longer prioritizes towards that conversion of androstenedione to estrone. Because if your body is in a fight or flight state, it could care less whether or not you got the right amount of hormones, because it's trying to survive right? Body always prioritizes towards survival over anything else. That's why during this time, it's been so important to make sure that we keep ourselves out of stress. Hard to do, I know, but when we're in stress, our immune function goes down too, right? So back to hormones. So when you start to go through this transition, one of the things that can happen in the bumpy years, I call them, is that sometimes you just have off months because you have dud eggs, and those dud eggs don't produce good amounts of progesterone, and then you end up in estrogen dominance, and that just are temporary fluctuations. But if your body is under a lot of stress, as the hormone production in the ovaries go down, the adrenals don't come in and make enough androstenedione for the hormone production to happen in your fat cells. So it is natural to put on a little bit of weight during this time because your body needs it. If you're putting on no weight, or if you're having a hard time putting on weight, there's probably an imbalance going on in your system, right? And so we have to figure out what that imbalance is and why it's there, because it's normal to put on a little bit of weight. Now, if you're putting on weight out of control, that's an imbalance, and there's something causing that. And come in January, I'm doing like this, except for I'm going to do this every day for 7 days, and I'm going to walk you through every one of the factors that contributes to why the weight thing starts getting so wonky at this time of life, because there's many factors. You can't rest on your laurels from the past anymore if you're having a weight increase. So we're going to go live every day for 7 days. To educate you about how to learn your blueprint for why you're a person that's gaining weight. And then we're going to follow that up with a 4-month masterclass where we're going to take you through all those steps if you're a person that needs that support. Okay. So just know that that's coming. So hormone replacement therapy is helpful when a woman has a lot of stress on her body, like I did. And because when we've got low hormones, that stresses the system out. And then the system's stressed out and then you have low hormones and you end up in a vicious loop. So while you're getting the body balanced out, a little bit of bioidentical hormone replacement to just get you above water, so that then you can go about healing all the other stressors in your body and in your life, is super, super helpful. Because low estrogen has a lot of not good effects. They don't know it causes inflammation, but they know that when you have low estrogen, inflammation often is there. And inflammation is the driver of almost every disease process, right? Dementia, Alzheimer's, cancer, all of it, all the big bad boogie people. So we want to have healthy estrogen amounts. Now, if you're a person who, it's been basically healthy and now things are a little wonky for you, most likely you don't need bioidentical hormone replacement. Most likely we can just clean up whatever's in your body that is out of balance and get you back on track. Like I had a woman who had severe hot flashes, like crazy hot flashes, and she was trying everything and it wasn't working. And if she wasn't really a person that tended towards hormone replacement, but if she was, that's where she would have gone, but it probably wouldn't have helped. It might have helped a little bit, but what she had was a parasite. We got rid of the parasite, boom, the hot flashes stopped. Yeah. So very often hot flashes are driven by an immune challenge. And one thing that's interesting about hot flashes is that, do you know that it's breathing 15 minutes every day is more effective to treat hot flashes than hormones? Why? Because you're getting yourself out of stress. You're calming your system down, right? So cortisol really drives hot flashes. Anybody who has ever experienced them knows that you have a stress moment and you're getting hot and you're like, whoa. And if that's happening when you're not having a stress moment, you're having internal stress moments. So what's going on in your physiology that's causing this stress? Yeah. So we want to, so the game we're playing is, do we need hormone replacement? And that is a decision that I think you really need to make with a health provider, because it's not really something you can make on your own. You have to be able to evaluate your system, okay, and what's going on and how complex things are. Now, if you're a person who has tried, like, the black cohosh or the formulas that are for menopause and they're not helping you, then you're probably a person that has internal stressors. and you need to get rid of the internal stressors. And so the important thing to know about this is, regardless of whether you take bioidentical hormones or not, you want to get rid of the internal stressors, because they're still, you know, causing a degenerative process in the body. They're still causing inflammation in the body. They're still causing stress in the body. They can still cause brain fog in the body, all of that, right? So if you decide that you want to go on, you want to use some bioidentical hormones because things are just too bumpy, you never want to take estrogen without progesterone. You really want to stick towards a biased, as little estradiol as possible, with something called estriol, which is bone protective and doesn't seem to have the same potential dangers as estradiol does. Again, one of the reasons I love women to do it without hormone replacement is I like you to become estrone dominant, because that's part of the new juice of life. I had this one woman I was talking to the other day, and when she started going through it, oh my God, she was like, I don't like this. I don't want it. I don't like it. And I kept just going, sweetie, I swear this is good. No, I don't like it. And then she started putting on weight, and, you know, so we got figured out what was going on with her. It was a digestive issue. And she started working out, and she looks stunningly beautiful again. And the other day we're talking on the you know, a Zoom conference, and she's like, well, you know, I'm not like out there looking for a man. I'm really into just like getting into myself and really connecting with myself and really looking at what I want to offer back. And I just started laughing, and I said, I told you it was coming. And she goes, I know. You know, when we're in the transition, it can be really just disjointing or jarring for some women. Like, you know, I don't like this, but I promise you, if you stay with it, and if you do the work, and if you get your system balanced out, you're going to come to the other side, and the gifts are so juicy. We get our life back. We're no longer driven to like please other people all the time. My one girlfriend, we laugh all the time, because when she calls me up one day, she goes, oh my God, Cari, you're so right. She goes, he just asked me to do something, and I just looked at him and I said, nope. She goes, I would have never done that. We get our no back, our holy no. And when we're balanced, that no can be lovely and gracious and doesn't have to be cranky. But we get our no back, where we get to decide, like, yeah, no, I don't really, that's not good for me. That's not healthy for me. That's not the highest for me. That's not the highest for my family. That's not the highest for, right? Okay. So so who does hormone replacement benefit? Are these people whose systems are very stressed out. That's where I was. I decided to use a little bit when things were just in that vicious spin. That is not what got me out of the vicious spin, I will tell you, but it got me above water so that I could function. I could barely move. I was so exhausted. Yeah. So those are the women that really bioidentical hormone replacement therapy is indicated for. But like I said, they do come at a cost. You know, they're expensive. You got to get compounded. They cost hundreds of dollars a month. So you might want to start by getting support, seeing if your system can be balanced out without them, and going that route and putting the money in that route, because once you're on them, it's a journey. You're not just going off of them in a couple months. That's not what's happening. Okay. Now, when you're on bioidentical hormones, some of the negative side effects of it, besides money, is, like I said, they can cause that extra 5 pounds of weight, which some people really don't like. Estrogen can block the conversion of T4 into T3. And I see this in a lot of women without hormone replacement at this time of life, where you're not converting T4 into T3 enough, and you have a slightly low T3 level. And T3 is the active form of thyroid. So you go to your doctor, and your doctor does their thyroid test. What they do is something called a TSH with a differential, which means they run a TSH, and if the TSH is normal, they don't run free T4 and free T3. Well, without those numbers, we don't really know what's going on, because I see all the time that TSH is normal and free T3 is slightly under, and slightly under can cause symptoms like weight gain and depression and lethargy and all of that kind of stuff. And then we really need another marker called reverse T3, because if you're not converting, we need to see, is it that you're not converting or it's getting turned into reverse T3? And if that's happening, then that's straight up stress. So we know how to focus. Is it a digestive issue? That's where the conversion happens, or is it a stress issue? So getting a proper thyroid panel, super, super important. And if you're on bioidentical hormones, making sure you're getting that look at all those markers is also important, because you can start off fine, and then you can stop, that estrogen can start blocking that T4 to T3 conversion. And now you're gaining weight and you're feeling sluggish and you're, got the blahs. I remember I would wake up every morning just like, when I just had a 0.2 below normal T3, and I put myself on a little bit of a supplemental regime to support the T3 conversion, and all those symptoms went away. Yeah. And so I know that if I start to inch up on my weight, I got to think about, well, wait, what's going on with my T3? Am I not converting enough right now? Yeah. It's one of the things for me. So I was always underweight. And when I went through the change, I gained the ability to gain weight, which was amazing. I also fell in love with a man who likes really yummy, sweet things. And so, that made me juicy up a little bit, but I did put on some weight. And so now I do have to be careful in that if I have too many party days, that weight comes up and doesn't come back down. And that I know is partly the hormone, because when I've gone off of them or decreased them, I started losing those extra 5 pounds, right? So you don't want to, I'm not telling you not to take the hormones, because if your system's super stressed out, then it might be the most loving thing to do. But just know that you don't want to beat your body up if it's carrying a little extra weight, because it might be because of the hormones that you're taking. Yeah. So, they also can gunk up the liver. So if you take hormones, I recommend you start slow and you increase them, particularly if you're a person who has some health challenges. So if you've got, if your system's under a lot of stress, you don't conjugate, your liver doesn't do a good job of detoxifying. You're weak, you're underweight, or you have immune challenges. These are all the things that might be a reason why we take bioidentical hormones, but they're also the things that make us generally need less, because we can't tolerate too much. So I see a lot of women who come in on, I think it's called the Wiley protocol, and it's a protocol that's designed, I think, to keep women bleeding. It's pretty high levels, like 200 milligrams of progesterone. I take 60, right? And that's a lot comparatively. And their systems are just gunked up. It's just too many hormones. So they have headaches, and like I said, the breast tenderness and moodiness and all that kind of stuff. So you want to start off slow and then gradually work your way up. But remember, you're doing the Dutch test first. No, taking them without it. You could be really creating a problem for yourself. And the Dutch test will tell you. And then once you do the Dutch test, you see how you metabolize. 3 months later, you're doing that Dutch test again to make sure that that pathway is still open and working. There are things you can do to support the pathway, but you want to make sure that you're methylating properly and that you're conjugating properly. Okay. Now, one of the things I was going back to is the liver. So your liver, if you drink alcohol, the liver can get more gunked up. You're doing recreational drugs, the liver can get more gunked up. You're eating crap, chemically ridden altered products, like I talk about in my book, your liver can get gunked up. And when the liver gets gunked up, it doesn't conjugate the hormones out. So it can build up a little bit, and you can end up with too much in your body. So I'm not trying to freak you guys out. I'm not trying to make this seem impossible. I just want you to be smart, because if you end up with too much hormones in the body, your hormone receptors shut down, and then you feel like you're low and you get all the symptoms. And then, some doctors will just try to up your hormones. And that's not the answer. The answer is actually to get your liver functioning better so that you can tolerate, maybe adjust the dose so that you can tolerate. Now, estrogen is, like I said, proliferative, and it's not really the thing that helps with the hot flashes as much as the progesterone does. And the progesterone is calming. So taking progesterone at night is a good idea. I take mine as a troche, they call it troche, but I say troche, it's French. Anyway, a troche, and I and because I suck on it. The pill I didn't like because it went in and then it got stuck in my throat before I went to bed and all of that. But that helps with sleep. So if sleep is an issue, you may have an imbalance between your estrogen and your progesterone levels. The other thing that plays a big factor in all of this hormone stuff is xenoestrogens, fake hormones that are in your body turning on that estrogen. You want to be very careful about being estrogen dominant. That's what predisposes us to the nasties, the cancers and the breasts and the ovaries and the fibroids and all of that kind of stuff, right? So you want to make sure that you're not estrogen dominant and you have a good balance of estrogen and progesterone. One of the reasons why you never take estrogen without progesterone. But you can have low estrogen and low progesterone naturally and still be estrogen dominant. I just saw that in somebody. It doesn't mean that you don't want to still get that balance back. And that might be a case where a little bit of progesterone only might help balance out a woman who's still cycling. But you do want to be following that. So you don't, I meet so many women who were put on hormones. This one woman, she was in her 70s or something, and she was put on progesterone only by a doctor in her 50s, and she was still taking it. And nobody's checking, nobody's this and that. And by 70, you probably are, you can start looking at weaning yourself off of that stuff, you know? So we're not on this forever. This is to get us through the transition, get our body balanced out. And then as we're doing better, we should be able to hopefully wean ourselves down as our immune challenges are handled, as we're sleeping better, as we've created balance in our life, as we've developed meditation practices and breathing practices, and we're exercising and doing all the good things to take care of ourselves, eventually we should be able to wean off of the hormones. So I'm just going to peek at my notes. While I do, if you have any questions, put them in the chat. I just want to make sure I didn't miss anything. Okay. So now, if you're a woman who's on the fence about whether you take hormones or not, the first thing that I would do is I would evaluate your health journey. Has it been pretty good up until now, and now it's getting a little crazy? Most likely, with support, you can get that handled and you don't need to take hormone replacement, okay? Have you had kind of a bumpy health challenge for a long time and now it's seemingly bumpier? Getting your hormones evaluated, getting the Dutch test where you look at your pathways evaluated, you might be a candidate for a little bit of hormone replacement. But I like to say that you want to do everything simultaneously. You don't want to rely on hormone replacement to fix the imbalance, because with it, you get all that other stuff, the not good stuff that I talked about in the beginning. Does that make sense? So you want to be working on your internal stress level. You want to be working on your external stress level, your life. You want to be finding, like creating a balanced life that you love. You want to be doing all of that simultaneously with the hormone replacement. Do not rely on hormone replacement only as the fix, because that doesn't fix the adrenals. And so that doesn't fix your body's ability to adapt to stress. And prolonged stress is the number one thing that causes inflammation and then causes sickness, right? It's a vicious cycle. So please don't take hormone replacement therapy and think you're done. Hormone replacement therapy, like I said, gives you a boost, get your head above water so that you can do the other work. Does that make sense? And so I have a question. How long would I be taking the other supportive herbs to see that they help before exploring HA? Like 6 months? Well, if they're not working, it's not that you go straight into hormone therapy. That's a great question. If the other stuff, the supportive herbs you're taking isn't helping, it's usually because there's an immune challenge or some internal imbalance, an imbalanced lifestyle choice, too much coffee, intermittent fasting, things like that, that are driving stress on the system. So it's not like we go from, oh, let me try the supplements to hormone replacement. We go, oh, let me try the supplements. Hey, they're not working. Let me figure out what's going on in my physiology that is throwing me into a state of imbalance, right? Let me figure out. When people see me, they fill out this questionnaire and it evaluates every system in their body and says, there's stress here, there's stress here, then there's stress here. That's what we fix. I don't even talk hormones with women in most cases in the beginning. I just fix all the stress and then we see what happens. And if the hormones are out of balance still, then we'll run hormone labs. Then we'll look at, what's going on with the hormones and then see what is the best option, right? Very rare that I start with a hormone test when a woman comes in when she's having hormonal imbalances, because if you're still bleeding, the problem most likely is in the liver. And so I'm going to clean up anything that's stressing out the liver. If you're not still bleeding, most likely the problem is in the adrenals. So I'm going to clean up anything that's stressing out the adrenals before I ever think about hormone replacement. Now, if somebody's really like spinning out, freaking out, maybe I'll start there. But very rarely do I, because there's great supplements that can calm down anxiety. I mean, God, I got this one supplement that if it's right for somebody, boy, it just changes people's experience so fast. It's amazing. And gosh, I never had anxiety before this. I didn't even really understand it. I was like, just breathe through it. Take breaths. You know what, people, it helps to breathe for it not to get worse, but it actually doesn't stop it. And I didn't understand that when I was, before I had experienced it, right? So you want to be looking at the system before we go down the HRT route. Because like I said, it comes with a cost, and most prescription medications have a cost to them. So I always say with any prescription medication, we want to try to go without until we can't, right? I mean, we're lucky that we have some medications for really imbalanced situations, but we want to try to go without because they do have a cost to the body. In other words, they create toxic byproducts that the liver has to detoxify, and those can have other effects in the system and stuff like that. Yeah. So we go, if we try stuff on our own, it doesn't work. Then we go, okay, there must be some other stressor in my system that I don't know about. We get some support around figuring that out. And then we go into the, okay, well, maybe bioidentical hormones might be helpful while I solve this. Let's say there's a lot of problems. Yeah. Which I see a lot of problems sometimes in some bodies. If you have a history of Lyme's disease or Epstein-Barr, or you can't often tolerate the tonics because it aggravates those. And so you have to, you might need a little hormone replacement while you continue to heal those. That was my case, right? After I got thrown into cray world, I couldn't take the natural supplements. That's why I went for bioidentical, because the tonics. So what are tonics? Tonics build up your system. In Chinese medicine, menopause is what's called a yin deficiency, because your hormones go down, your fluids get less, you dry out, right? So the supplements that help that are moistening, but moistening supplements can moisten the bugs, can give the bugs food to feed them. Like in Chinese medicine, most of the moistening substances have a sweet flavor by nature. Sweet feeds bugs, they like it. So if we've got a lot of bug imbalance in our body, then without addressing that, if we just take the tonics, we will create more imbalance in our system, or it just won't work. Yeah. So I'm trying to think if there's anything else. This went pretty fast. So let me think. Is there anything else that you guys can think of that I didn't touch on here? Any other questions? Any questions about anything? It doesn't have to be just about hormone replacement. And if you don't have any other questions, then I will talk a little bit about the holidays coming up. So let's see if anybody else has another question. Did you feel like I handled it? Just give me a yes over there in the chat if you felt like I gave you a good overview of hormone replacement. Great. Got one yes. Any other yeses in there? Well, maybe people. Okay, yes, great. Okay, great, Susan. Thanks for joining us. Okay, so now it's the holidays. And it's a really important time, because if you're in this transition and you're trying to moderate stress, holidays can be a very stressful time. So I want to give you guys some tips for how to get through them without, gaining weight, or if keeping weight on is your problem, losing weight, without throwing your system into more imbalance and more stress, right? So remember, you're in this transition and you're going from being estradiol dominant, focus on everybody else, to estrone dominant. Include yourself in that picture. So one of the things I want you to start to practice during these holidays is me, not me, but you. I want you to start to practice including you in the schedule, in the scenario. If you're a chronic meal skipper, that is one of the biggest things that creates stress, chronic stress on the body. Intermittent fasting, this time of life, not helping. We need our cortisol levels even. Intermittent fasting promotes cortisol spikes. We do not need to spike our cortisol. Our cortisol spikes, we stop making our estrogens, our liver gets gunked up, and we don't feel good. Keep our alcohol consumption to a minimum, certainly not every night, certainly not multiple drinks in a night. That really gunks up that liver and adrenal system. Coffee, try to keep it to 1 cup or less a day. Caffeine stimulates hot flashes and stimulates cortisol surges, which stimulates the lower production of the hormones. Chocolate, keep chocolate in the morning, earlier in the day, not later in the day. It has 2 stimulants in it. It will disturb sleep. I had a friend staying with me, and she came out in the morning. She's like, "Oh my God, I was up all jacked up all night." And I said, "Well, you ate chocolate at 10 o'clock at night last night." She's like, "It's not the chocolate." She calls me up the other day and she's like, "Oh my God, I'm so sorry." And I go, "It's okay." Because she says, "It's not the chocolate. I've eaten chocolate at night for years and it's fine." Yeah, but that was then. This is now. We're in a whole different game now. So it is a stimulant. It actually has more stimulants in it than coffee. So daytime only. Okay, same thing with any kind of coffee or tea, daytime only. And try not to do it every day. Make yourself some yummy other drinks other than coffee in the morning. Matcha tea, which has a ton of benefits to it. My husband makes me a matcha latte and presents it to me. It's the sweetest thing ever. Gives me a little poem with it, that you could do. You could do that with your husband. It's our little ritual. We sit down to our little matcha something. Not matcha something, our frothy something. We love the frothy. Got one of those milk steamers, and it's just such a sweet moment in life. I cherish those moments. And so look at other things you can drink besides that. If you like spicy food, do that in the morning. I know that you're like, spicy food in the morning, what? Or lunch, don't do it at dinner. That will aggravate the hot flashes and all of that. So sometimes it's just stuff we're doing in our life that's causing us to feel imbalanced. And if we just change our life, then those symptoms will get better. So we want to keep our exercise in. Super important. Why our liver needs it so much. It needs that circulation. Circulation has so many benefits. Go to my YouTube channel and watch my little video about exercise, because it has like a multitude of benefits. So keep your exercise in. Sleep. Make sure you're getting your sleep. Okay. Don't start, cutting down sleep because you got too much to do. Your family that you are going to be spending time with wants you there happy more than they want the table perfect or the thing this or that. You there happy is the biggest gift that you can give them. You there with your heart on is the biggest gift that you can give them, much more than anything being just so. So please make that the priority, and that comes from your own self-care. So keep self-care in during these holidays. There are so many times when we will get triggered by things during the holidays. We're hanging out with our people who, if you haven't heard me talk about outdated survival programming, I'm going to talk about it, I think, in December, because we are getting our outdated survival programming banged on during the holidays, either because we're alone or because we're with the people who created the programs in the first place. And so I'm going to talk about outdated survival programming and how to help you navigate it, because it becomes so much more important at this stage of life. As our hormones thin, our ability to handle stuff it goes down. That's why digestive issues that were lingering sort of a little bit of a problem become a much bigger problem now. That's why little low-grade thyroid problems become a much bigger problem now. That's why our emotions become much more imbalanced now. Yeah. So what you want to allow extra time for during this time is you to have time to process this stuff. Yeah. Does that make sense? You want to be able to actually have time to reflect in, do some deep breathing, and get yourself out of the reactive mind and back into center. And I'll give you some tools on how to do that in our call next week. Okay, next month. I don't know what day in December yet is. I haven't looked at the calendar, but watch your emails. You will get an email. It'll be in the Facebook group. If you're not part of the Facebook group, please join us. That's where this replay will be. And this group is really for us to create community, to support each other, to get balanced out so that we can claim our wise woman. I remember I was talking with this Swami, amazing woman. She's a Westerner who moved to India, and she was telling me about her menopausal story, and it was pretty imbalanced. And so I'm talking with her about it, and Jonathan, my husband, chips in. Oh, tell her the name of your program. And I said, well, it's Wise Woman Emerging. And she looks at me and she goes, I could have cared less about my wise woman when I was sweating like that. And that's the truth, right? When we're out of balance and we're struggling and we're not liking ourselves and we're feeling fat and all of those things that happen, and we're hot, we're sweating and having to rip our clothes off, and we're not sleeping well and all of that, we don't care about our wise woman. But this is where this is heading. And we can never claim it. So I don't consider menopause actually to be when we've stopped bleeding. I consider menopause us to be done with menopause or in menopause fully when we've stepped into this new role. So I consider myself still on the journey, right? So we want to add into our routine time for ourselves so that we have time to undo those triggers, bring ourselves back to neutral, and then we can show up as the gift that we are to those people around us. I've been practicing medicine for 21 years, and I will tell you that most of the time we either did it to ourselves by the choices we were making, or we're doing it to ourselves by the choices we are making. Yeah. So you want to be mindful of that. Look around. I have a video that in the Facebook group, there's a video that I did that talks about some of the lifestyle choices we're doing and what you can do to help balance yourself out. You can watch that. There's some videos in there where I talk about the different diets, ketogenic versus intermittent fasting. You guys know how I feel about that. Versus Mediterranean, you can get a little bit of information about that. You can ask questions in there at any time. We get off the call and you're like, oh no, I didn't ask her. Go in the group and ask questions. So you'll get an email with the link to the group. That's where this replay will be. But until then, start to look around for where you can include you in your schedule. Look for where you can have some solo time, not with your phone, but with your heart. Maybe take up journaling or just sitting. I love to just take a tea and sit outside on my porch and watch the birds. It's a beautiful time. Yeah. Remember that 15 minutes of breathing a day, it does more for hot flashes than hormones. And remember that hormone replacement is a tool we can use, but in my opinion, it's a tool that we use only when we really need it. Otherwise, we do everything we can to get ourselves balanced out without it. So I hope this was helpful to you. Sending you all so much love. If you have any questions, we'll give you one last minute to ask any more questions that you have before we sign off. And give some people some time to type in case they're slow typers like me. Okay, well, it looks like not. So thank you so much, ladies, for showing up. And I look forward to connecting with you in December. And then, in January, starting January 10th, put it on your calendar. We're going to do this for 7 days, every day. We're going to meet, and I'm going to give you some more data on how to navigate this whole weight piece. The beginning of the year, usually people are really focused on that. So I thought it was a good time to offer that to you. Sending you so much love.